Sathyabama Institute of Science and Technology.
Hello all, this is Dr. Priya Kumari, Sathyabama Institute of Science and Technology, deemed to be University, Sathyabama College of Physiotherapy. I welcome you all to Physio Beats, the podcast where we are going to explore the field of physiotherapy, emerging trends, innovations, and all the developments in this field by different experts from our profession. To share his expertise, today we have with us Dr. S.G. Sudan, who is a principal, Kripanidhi College, Bangalore. We are honored to have you, sir, with us, and will be really privileged to come to know about your expertise in the field of physiotherapy. Please share your experiences and journey of reaching here and your inspiration for many physiotherapists. So we'd like to hear from you.
Thank you. Dear all, it's a great opportunity and a pleasure being here with you all through this podcast. So, my career has started around now 25 years as such in the field of physiotherapy. So, it's been a very enjoyable progression through the profession day to day. So, I've explored multiple things in physiotherapy and the allied areas. The earlier dates where when physiotherapy was not that much popular among the students' choice, I had chosen this just because of the interest in physical fitness or exercise. So I have thought that always that helps. And I found exercise therapy as a very important choice in that particular subject aspect. So that's how I entered this. So once I finished, I've been exploring multiple avenues right from fitness, say 20, 25 years ago. So that was really a time where fitness was not a boom, just as what you see post-COVID at the recent ages. So I've tried that. Then clinical side. And finally, I thought of getting into the teaching area. So I felt much interested in that particular aspect. So, and I chose teaching profession. From then on, say from 2003 onwards, I've been in the teaching area, and I'm currently at the position of principal. I've come through various levels of progression, and I've worked with multiple institutions. So, yeah, it has been a very happy time being in the profession.
And so in the current scenario, actually, the students, they do have this question like, what is the future of physiotherapy? And now technologically, it is getting equipped so much. So what do you feel, these emerging trends, how it has changed or reimagine, how we can reimagine physiotherapy?
If we see the perspective of physiotherapy, I would say we definitely have a very bright future for those who are beginning the career as well as who are in the profession still not finding a shore. Definitely, I would say the perspective is very good.
Okay.
Now, the physiotherapy, is a very noble profession, and gone are the days that where physiotherapist was not, in the mainstream. Currently, we are in the mainstream, and we have the days where physios are having a home, say family just like physicians, we have family physiotherapists also there. And if we see the scope, I like to put across in three different areas. One is education and research, then clinical, and in general, I would consider. So in education, we have varying scope, as you know, in the teaching area, as well as the research aspect. Now, if we clinical, it's more of a hospital-based or their own entrepreneurship. Multiple people are doing that. They are shining out very well in the entrepreneurship itself. And we also have area of prehabilitation where we call. So earlier we only think about rehabilitation. Physiotherapists were in the clinical aspect as a rehabilitation specialist.
Okay.
Now the days have been demanding to be a prehab where we prevent. So right from be it ergonomics or be it use of artificial intelligence. So all those things are aimed at rehabilitation. So the field is emerging very much, futuristic, I would say, and we are having a very good perspective in the field of physiotherapy.
Yes, sir. And I myself, being a physio, I can realize that I've seen the trend, the changing trend, and I see how, how it's going to a different level. And with the added technology, I feel definitely our students will benefit, and the patients also, they are going to, accept this new physiotherapy added up to the conventional in a new form.
Yes, yes, absolutely. So now, when we speak about conventional therapy, I only see this much applicable when we talk in terms of research.
Okay.
So when we are comparing with some advanced treatment or this thing. But in clinical practice, I think most of the physios have adapted to the modern technologies.
Yes.
And they are updated. So those who are not updated, definitely they are in a forced situation to update themselves.
Correct.
Otherwise, they are not going to be competitive in this current
Yes.
scenario. So the recent trends are more like digitalization we have.
Yes.
So we have multiple artificial intelligence which is taking up the field. So I feel that is a real leap in the physiotherapy profession. Be it in any sector, be it in education, we do depend on technology as such, and be it in a clinical setup, we do rely on that.
Yes.
And those who think that the conventional way is enough, definitely they have to change. They have to,
Yes, they have to get updated.
definitely update.
So can you share, like you would have seen so many patients and with your journey enriched with all the experience, any successful patient stories which you have come across?
Oh, yeah, sure. So if I have to share some recent ones, see, I had a very interesting patient who was referred from a hospital. And this patient, when I first met them, they were having a severe pain in the chest. Okay. So when a person says chest pain, obviously the first instance or the thought process and how they would go, we know, right? So, and the person has been having this for the past, say, 1.5 years, and he's been running around multiple hospitals, and there was not a solution for it. So this is how I met the patient. There is no other problem in the patient. So just he had this pain over the chest area. So what I would like to stress here is a detailed evaluation was done on this patient, and we found a trigger on the pectoralis major. Okay, a trigger point as such. So now dry needling is a concept which is of a recent decades origin and all that. And we did only one trigger release of the pectoralis major, and the pain was gone. So the moment that was released, the patient's expression and the patient's happiness over that. And see, when a person is thinking about some cardiac problem or something, and he's been carrying that for 1.5 years without a solution, you give a relief at a moment. So that's really a wonderful experience what you get. So that's really good. Then if I have to say more about the experience, I had to bring in the COVID scenario. So where we had seen patients in the ICUs. So very, very critical. Everybody is aware of the situation, what we had faced through that time. That time we didn't have any guided regulation like this is the treatment for COVID. Nobody has. So everybody was evolving. So we had to rely on the internet sources, how that hospital is doing, how the global and the other side is were treating. And we had formulated a teamwork was there through the entire, right from the physician to the nurses, everything. We worked as a team, and we formulated a set of programs for the physio as well as for the patient treatment. So that gave a real success, and we had brought back through our effective rehabilitation so many people who were still 25 years, 20 years or 40 years, whatever be it, their functional ability was really improved through the system what we developed as a team. Yes. So these are really good ones, and we have even published that.
Okay,
so it is a real good experience which I will recall now.
Sir, in physiotherapy, I really want to that standard should be raised. It should be raised to another level, because people, what they think those are not much aware. Now the things have changed, but they think it as just a massage or maybe some exercise through electrotherapy equipments. But it is way beyond. It is much more than that. What we can offer, and it's a altogether different profession where you can treat with exercises or with this technology blended with the exercise. So how what you highlight about the misleading domains which infiltrate the physiotherapy, and people take it in a different way, and how to come out of it, and how to raise the standards for our profession.
So, raising the standards, if we say, we have to think about evidence-based practice as
Yes, very
such.
true.
So, this evidence-based practice is over now 2 decades we have that, and still if we currently step into PubMed also, you will find articles which are coming about this evidence-based practice. So,
Correct.
up to date, this is a well-set model which we are doing it. Now, recently, this EBP is moved a little into a knowledge aspect. They call knowledge-based practice. That is also one trend which we need to understand. And the one drawback what we see in evidence-based practice is less value for the patient values as well as their preferences. So if we add this, definitely the treatment what we are going to do would be really a good one for the patient's benefit. And the view about misleading things or the patients thinking that physiotherapy is this,
Yes.
I think currently everybody is adapted to the modern way of practice.
Correct.
So definitely the views are coming down. What you say may be true in remote setups, but in developed places definitely this vision has come down. And now the entire perspective of physiotherapy is changing. So now recently we have the ministers or the government itself coming forward and telling about the importance of physiotherapy and what it does. Okay. Particularly the post-COVID era has really gained the momentum for the profession.
Correct.
So the misleading areas are now slowly coming down, is what I feel.
Yes, this is very true. And now things are changing, but still a lot more has to be done. And I'm sure the viewers also are listening. They will, understand the importance of doing research, innovation, and assessment mainly. I feel thorough assessment is very important, right? To diagnose and come closer to the case, and take things in our hands as a physio, and then based on that we can give the therapy rather than straight away just concluding some diagnosis and giving, or following some other pre-diagnosed things.
True. It is very important that we have to have our own evaluation because things are dynamic.
Yes.
Certain times we may misinterpret something. So it is always good to go with an evaluation is what I would support, and follow the EBP as what we are discussing. That is very much important. So to maximize the effectiveness on the patient's outcome, what a physio I would suggest is we should have a mind to change or adapt. So there are certain schools who think that we have to stick on to the conventional mode or the older way because this is what physiotherapy, what we have learned. But we should open our mind to look in for what is the recent advancements. That will give a betterment for us as well as the patient is going to greatly benefit. So that openness and willingness to change and adapt is of crucial importance to maximize the effectiveness of the physiotherapy treatment as such.
Very true, sir.
Yeah.
So at last, what can you give one take-home message for our fellow physiotherapists and students especially, so that, to keep their motivation level high and go explore more and more, do more research, come out with some new ideas, and help to the community and society and the patients all.
Okay. Yeah. So, first of all, I would like to say that the physiotherapy field is very dynamic. It is, dynamically growing is what I mean to say. And it is, for the students, you should understand this is a field full of opportunities we have. So, it is how you perceive and how your mind is set to. If you are oriented towards a goal, please proceed and you can really achieve greater heights. Now, the one word that I can tell is, student, you should choose wise. Choose wise means you are setting up your, where you're going to go. So definitely your choices are placed before you. It is you who adopt, right from choosing things or taking out. Even see, when we talked about the choice of treatments, now physiotherapist has a toolbox. So it is what you take out from that to do a treatment is up to you. So
Correct.
that is when some people go wrong with misled by some new technologies they claim without a proper research. So when you choose something proper, your end is or destination is going to be really good. So for student community, I would say you choose wise. And for the patients, what I would say, now currently, as I said, we have family physios, right?
Yes.
So you need to be really wise in choosing whom you are going to. There may be multiple people, but to understand, not just go by the reviews of some, no, we look into that. When we search for a physio, obviously look in for some reviews like this is
Yeah, they'll
good, that
Google
is
it and
good, or
find
like
out.
that.
Yeah.
So, but that is not the reality actually. So you need to be wise choosing a physio for yourself, because why I am stressing that is the physios are really going to help in cutting down your health concerns in the later date. So right from the young kid to the oldest person on the family, it is important for you to choose wise. And for physio, as such who are in the field, I would say act wise. Okay,
Yes.
so ever be wise. So please act wise in the way what you're supposed to. Leave away all the differences. You need to be open mind to accept things and look in for a mutual benefit on the interest of the patient. So if you consider this, definitely it's going to be a wise decision.
Thank you, sir, for sharing your valuable, giving your valuable time and sharing your expertise and knowledge in the field of physiotherapy. To conclude, we should be wise to choose and act wise, and students should keep on doing research, innovation, keep exploring, and get updated to raise the standards of our profession. So, at the end, stay fit and keep progressing. Thank you for joining us.